And I am so sorry. I think I did not press the button and the event was not started, but let's see. Hello, everybody. Are you able to hear me or we just started? Are you able to hear me? Okay. So I will start it again because I know you were not able to hear me and I did not press the button. So we are just starting up this event. So thank you very much for watching my show. And again, today I'm going to talk about this very interesting GPT versus AI. And we will be discussing the top use cases for AI in healthcare today. Artificial intelligence versus human intelligence. That's my favorite subjects. When we talk about artificial intelligence and human intelligence. So I don't know if you guys have ever heard about this IBM Watson. This happens like in last 10 years. This was used to be the most popular terminology when everybody was talking about artificial intelligence, and IBM has been talking about it for a long time. And guess what happened? It slowly died. It started with a bang. Millions and billions of dollars were invested into it, and it did not work. It did not deliver to the promises. So it is a very interesting AI and chat GPT field is a very interesting field. But today, before starting the show, I'm going to show you something uh, uh, really nice, and you are going to like it. So let me share my screen with you and show you how AI works in healthcare. Okay, so watch this. When I type, this is my chat GPT tool, by the way. And if I type, um, can kidney patients undergo a spine surgery? So I just typed it and look at the results. This automatically generating, this is chat GPT. The software is generating the answer about the context I wanted it to give me the solution. Now you can find similar thing in Google, but see what happens. So if I type the same thing in Google and I see that, you know, the results are totally different. If I do the same thing in Google, and you will see what kind of results it gives, right? It gives a different type of results. So if I do Google, watch what happens. So Google gives me a different type of results where it says, oh, it gives me a different articles. And it does not give me exactly and different articles, different resources, different ways. So I have to actually go find what would be the best according to the context, according to I have to find in this particular resource. So this is the difference we are talking about when we talk about AI and healthcare. I'm trying to simplify it for you because I know a lot of physicians are looking for it. So for years, this has been speculated that, the artificial intelligence is going to transform healthcare. And I think with the version 3, version 4, this is, this is now coming up and taking a shape. So I'm going to give you some idea how chat GPT or how AI can do the easiest thing. So the easiest thing would be in medical imaging, where AI is being used to analyze medical images such as X-rays, CT scans, MRI scans, right? They assist doctors in making more accurate and faster diagnosis, better decisions. Very easy to do. Actually, IBM Watson was able to do this, and now it is being happening. Predictive analysis. So where AI is being used to analyze patient data. So kind of we're talking about identify those who are at high risk of developing certain conditions or diseases, such as diabetes or heart diseases. This allows doctors to intervene early and prevent the onset of these conditions. And doctors do it by themselves also. So it's basically trying to replace or augment doctors' role. Drug development, research and education is a huge area which is benefited by AI and ChatGPT. We just saw the results, very simple results. Virtual assistants, that technology is also great for communication. Personalized treatment. So this is all easy stuff which AI and ChatGPT can do right now for healthcare. This is not why I'm doing this session today. I want to do this session today because I wanted to show you what is the real use, which probably a potential clinical practices and managers and doctors and medical groups they are trying to do with the use of AI. And the advancement of these tools is really in a very advanced stage, and every day it's just taking new leaps. So first and foremost, which is very critical, is a patient communication. That is absolutely something which people are trying to solve this problem, because what happens in patient communication, and especially in healthcare, if you see, there are a lot of standard templates and standard templated communication between patient and physicians. all of that could be all of that could be absolutely um, streamlined, and it can be done by using AI and ChatGPT. Appointment reminders, marketing materials, fax messages. Fax machine don't exist anymore, right? It's completely gone from the healthcare environment. Only very few healthcare practices they use fax machines. Um, all kind of communication, even the voice communication, it can be automated. uh, Patient accounting, where patient has to pay their bills, they need to know about the potential appointments available. um, Contact centers, you don't need humans or anybody human contact to call the physician patients in person. You can use for patient communication, you can absolutely use um, AI and Chat GPT, very easy. So those startups who are trying to focus into one area, this is a great area to focus upon, which is patient communication, solving these standard things using AI and Chat GPT. Second most important thing is when it comes to clinical documentation, and that's where we need help and using natural language processing. So in today's session, if the doctors are listening it, you have to be little technical to understand what I'm talking about, because I'm going to use some technical terms: NLP, Chat GPT, AI, and I will try to explain you what it means. But if you Google it, you go there and you will know what I'm talking about. So natural language processing is very simple. What you were using for like Olympus dictaphones, or you were using any kind of dictation platform. Speech recognition within the EMR system, if you're using one, or virtually scribe, all of these, you can capture these, you can capture all of that thing using AI. And the best way to do this is either there is an innovation comes from your EMR company, or any startups or any third party tools, they come up with some kind of solutions to replace that particular functionality, to ease burnout for doctors, where they don't have to take on the repetitive tasks. So it can even provide clinical decision support, and it can be incorporated like in an EMR. So if you're using eClinicalWorks, if you're using Epic, if you're using any kind of EMR, they all are these days working on developing these innovative tools which can help augment physicians, aid physicians, and try to give them as much support as they can from the technology perspective using AI. So, in theory, like physicians could enter patient information into the software and ask for a different diagnosis or preliminary treatment plan. So, like I just entered, give me the treatment plan for patient who has diabetes, and ChatGPT will actually give you the option. So even if as a doctor you don't remember everything, and if in good old days, you used to check the books. Now you can just type in there and you can see two or three options in front of you. So when you see those two or three options, it's very easy for you to pick one using your clinical knowledge, and you can suggest that to your patients. So this provides, like, an adequate kind of information. But again, it should not kind of replace you as a physician. That's the main thing. All of these education related information which is augmented by chat gpt or AI is good as long as you use it to aid yourself, to empower yourself, and not to replace yourself. So for clinicians, it is a great tool. Use it depends on the talk about college, whether the kind of software you're using, or even your own computer environment which you are into. Is it protected or safeguarding the patient clinical information? That's a number two. How communication we talked about. Then we talked about the clinical documentation, and then another third important, very important feature is how to improve billing operations and predictive analytics, which is like more reporting, financial side of your medical practice, financial reporting. All of those can be easily transformed using AI and Chat GPT. So sometimes if you have tools which are giving you enough, uh, which are not giving you enough information about your medical practice, you can use so like proper diagnosis. So I know a lot of coding, your diagnosis coding and procedure coding, it is happening. Oh my god, these are like, see, this is what the Chat GPT does, or this is what the problem with the, I will just exit to. So a lot of these billing operations like coding, right? Right now it is happening. Somebody is looking into your medical chart, reading the medical chart, and try to figure out your codes, diagnosis code, prognosis code. This all can be done using effective Chat GPT or AI use. So that would be completely eliminate a manual intervention or physical intervention into your medical chart. But again, you need somebody to verify that. Either you verify that medical chart as a physician, or your nurses can verify it before it becomes a bill and uh, goes to your insurance company. So that is another area which is happening right now, which provides a lot of good opportunities for startups. That's number three. So there is a very good agency who tried to do some kind of feedback survey, and they did about these AI tools. And a lot of these medical group managers who has participated in that survey, they says we have tried to use these AI tools, but none of them has worked 100% as advertised. So here is an opportunity for startups. This area is being evolved right now, and it provides a lot of opportunity for all kind of creative people, innovative people, and this area has a lot of opportunities for innovation. So again, this is not 100% right now, and this is, if you remember, we have talked about in my previous sessions public policy, there is, which is completely missing at this point of time. There is no regulations, no HIPAA regulations, no public policy which kind of drives this technology. So it is very important for you to understand it. What are the resources available to you? What is the public policy available to you? And how you are trying to solve the problem. There is a problem. There's clearly a problem. There is clearly an opportunity for innovation. You can increase the efficiency levels in medical offices and healthcare, but you have to figure out at what level of efficiency you can do it. So the major challenges, we talked about the opportunity. Now we are going to talk about the challenges and concerns. So within the patient and physician relationship, there is a one thing which is very important, which really very important, and it is called trust. When we talk about AI and we talk about human intelligence, so in any patient and physician relationship, which augments clinical judgment without replacing it. So that is the key. In AI, if your AI, your solution can continue to augment physicians and patient relationship and produces clinical judgments without replacing it. That means if your physician is using this as a tool to empower himself and giving the clinician judgments to the patients, then it will work perfectly fine, and it will work, it will aid the doctor. It would work like, fantastic results. So if a doctor is seeing 20, it used to see 20 patients in a day, he can see 30 patients in a day, because he would be very fast in decision making abilities, clinical decision making abilities, to see more patients. And especially if the more complex patients, which requires more research, this could be a great tool. So that's number one. So there is a challenge, there is a concern, and at the same time, the behavioral change. A physician should be able to adopt this technology in such a way that it augments his clinical decisions. Okay, that's number one. Number two, which is very, very dangerous, patient facing AI. You just saw what I did. I have some idea in my mind that why I'm not being treated, why my somebody is not being treated properly, and I don't have any answers from the physicians. I have seen myself to three physicians, four physicians. I'm not happy about it. Their clinical judgment. What did I do? I went into ChatGPT and I typed my own prognosis according to myself, and I came up with the outcome, and that outcome was generated by ChatGPT. Now, that outcome may work, may not work. And that clinician judgment comes with the trust. So I'll give you an example. There was an app called Coco. What that app does, it provides emotional support chat mechanism to mental health patients. And a lot of these patients, consumers, they were using that, and they were finding those AI generated messages. So about 4,000 consumers, they were seeking psychological support using this app. Now, their developers were licensed healthcare practitioners, but they have breached the duties of care and trust they owe to patients by providing an artificial solution, which is an AI intelligent solution, than as a consumer facing solution, wellness product. So it is a very gray area, missing public policy. Plus, when these patients knew about it, they felt that their trust was broken. And that is the main thing when it comes to physician and patient relationship. So sometimes patient facing AI, in the beginning it looks great, it gives you great results, but when it comes to trust, if it feels that, so I'm going to talk about this one particular, framework in my legal framework or starter. It's called accountability. So this breaches the accountability towards the profession, for patients, and that is where it is a big bottleneck for any startup idea or anything you want to do in healthcare. Accountability is a huge concern. If you don't have a trust and accountability in the solution, then it's not going to work out. So think about it. Any patient facing AI solution you try to develop, make sure that you fall into the category where trust or accountability is not breached or it's not broken. That's number two concern. Number three, I'm going to talk about is direct to consumer health advice. So, which is basically education and research, but for patients. So, like as a patient, I went into my Chat GPT software, I typed whatever the concern I had, and guess what? I got some fantastic results. I got some fantastic ideas. Oh, this can happen. This can happen. What can I do? I go back to my physician and ask this question, that can we do that? I found it on Google. I found it on ChatGPT that yes, this can be done. What do you think about it? So this is more like a pragmatic approach towards using ChatGPT AI to educate myself or educate patients outside the patient physician relationship. and it explains how it actually works. So if it is taken in that way, so it basically, you're not replacing these physicians, but you are at least empowering the patients with more ideas and with more solutions which they could not have thought, or their physicians could not have given it to them. Now, when it comes to consumer health advice, I have a very, my idea in my way, my thinking is at a global scenario when we see it, like especially in US, yes, you have a public policy, you have a lot of rules, you have consumer uh, rights, you have, HIPAA regulations, you have different type of regulations which kinds of protects patients and as well as medicine as a profession. But in other countries, in a countries like India, in a countries like Mexico, in a countries like where the rules are a little bit relaxed, and then patients are ready to take a little bit more risk, and physicians are also very kind of ready to take a little bit more risk. They use this technology to empower themselves and find the solutions which probably not available to the patients here in US. And is a that is a real blessing when it comes to, and when it comes to direct to consumer health advice. So it's totally a different perspective if you're trying to go to a developing countries where this healthcare is being kind of regulated with more public policy and better rules. The ideas and the implementation and the outcome would be different. But when it comes to US, the outcome and the opportunities, uh, challenges and concerns are different. So my advice would be to startups that review the technology very carefully, look at all these framework which I have been talking about: public policy, payment system, accountability, reimbursement, and then see where you actually stand. What is your strength before developing or before creating a solutions which will produce some kind of outcome for physicians and patients. Well, today this is what it is, and thank you very much for watching my solution. I would continue to watch or see your messages, see your chat messages. If you have any questions, feel free to send me a message. All of my services here on LinkedIn is absolutely free. Let me know if you need any help. Thank you very much. Have a fantastic day.